So, welcome everyone to today's seminar. We're going to be going through the exams that you need for your GP training. There is basically two of them. So, we're going to touch base on what is the exam format, what do you expect during these exams, how to prepare for them, and any common mistakes that happen, and what kind of courses you can take for them. So, we're going to start with the very first one, which is the AKT. Now, the AKT, which is the MCQ format, um, you can take it in your ST2 onwards. So anytime in your ST2 year onwards, you can sit this exam. It happens 4 times a year, so Jan, April, July, and October. Now, the amounts of attempts has recently changed. So it was 4 attempts if you've entered the training before August 2023, but now it's 6 attempts. So for anyone who's a newcomer, a new trainee, it's going to be 6 attempts. Basically, the exam's 200 questions and it's divided 80% clinical, 10% admin, and 10% stats. And people always say the admin and stats are the easiest marks to get. Um, so this is what mainly people focus on to just get a full score in them. Now, the exam, it's about 2 hours and 40 minutes. And the fees, it's about £481. So you don't really want to be paying for these exams more than once, to be honest with you. Um, so basically, the way you prepare, I think you've all sat so many exams. A few of you, if you're IMGs, you've of course sat the PLAB 2, the PLAB, sorry, 1. And the PLAB 1 is kind of a bit similar to the AKT. So it's the best way to approach this is to have a set timetable to go through the high yield topics, the common topics that always come in the exam, and then do question banks. Now, I personally think that one question bank would not be enough, but this is my personal opinion. When you do the question banks, they all have mock exams in them. And I would honestly recommend leaving the mocks to the very end. You don't want to be doing a mock at the beginning and then getting a low score and being less motivated. So I would say do the question banks fully, whatever question bank you're going to pick, and then maybe go through their mocks at the end. And just keep notes with you as much as you can. There's certain topics that we all honestly can't really remember much. Like for me, for example, the development in children, the vaccination schedules, I couldn't really memorize them. So I left them to the very end to just go through them before the exam. Just see which topics are the most difficult for you. And then I would say revise them at the end. Now, the very common pitfalls that happen during the AKT preparation or the exam is that people tend to neglect the stats and the admins because they think they're the lowest score. So they focus more on the clinical part and they leave the stats and the admin to the very end. I would say you really don't want to be doing that because the clinical, we're going to see it all through ST1 and ST2. The stats and the admins are going to be completely new. So, and they're easy marks to get. So don't really leave them to the very last week or two and then try to pick up the stats and the admins. The other thing is that the courses for the stats and the admin, the ones for the RCGP does, is sold out quite easily. So if you're going to take these courses, you need to plan ahead. Now, another thing is that sometimes people depend fully on the MCQ question banks, and they don't really go through the guidelines. Now, at the end of the day, some of these question banks, they don't have a very detailed explanation. Now, the topics are going to remain the same. So if they're asking about hypertension management, the hypertension management is going to come in your AKT exam, but not necessarily the question, like copy paste. So you need to know your guidelines quite well. So just depending on the question banks and ignoring the guidelines completely is not a good way to go as well. And of course, time management is key. It's key in the AKT, it's key in the SCA exam. So poor time management is going to keep you behind and you're not going to be able to finish the exam in time. I would recommend finishing all the 200 questions, even if you feel like you don't know the question, because there's no negative marking. So if the question is wrong, you're not really going to get any negative marking. So just get all the 200 questions done if you can manage on time. Now we're going to do some questions together. Now, feel free to use your chat box or unmute to answer the questions. You don't necessarily have to know them, but I just want to show you how the questions come on in the AKT. So for this one, I know you can all see my screen, but I'll just read it out loud for you. So this is a 65-year-old male patient who's coming with a 6-week history of shortness of breath, ankle edema. His past medical history is hypertension and diabetes. Now, when you do an examination, there's bibasal crackles and bilateral pitting edema. His pro-BNP is 500. So before we answer the question, I just want you to use the chat or unmute to say, what is your diagnosis for this patient? Can anyone think about diagnosis? Yeah,
Heart
yeah,
failure.
yeah, perfect. So it is heart failure. So what do you think is the most appropriate diagnostic step with this pro-PNP level according to NICE guidelines? So if you're saying E, okay, so we're half there really. So it is an echo, but with this level of pro-PNP, we do it in 6 weeks. So basically, the guidelines are divided according to the pro-PNP level. Anything between 400 and 2,000 is 6 weeks. Anything above 2,000, this is an urgent referral and it's 2 weeks. Again, you don't need to memorize it now. You're gonna come through with these cases when you do your GP rotation. So if anyone is doing their GP rotation, it's important to know these guidelines. Like the referral criteria, the investigations, the monitoring, and so on. So this is according to NICE with the pro-BNP measurement. Now we're going to move on to the next question. Now, this is a mother who's bringing her 11-week-old daughter to the GP surgery. She's had her routine 12-week vaccinations, and she's basically asking what is her routine vaccination at 12 weeks according to the UK schedule. So, which one of these vaccinations is routinely given to infants at 12 weeks? Okay, meningitis. Anyone has any other thoughts? B, okay.
Pneumococcal conjugate vaccine.
Okay, yeah, well done. So it is PCV. So this is the vaccination schedule according to age, according to the UK schedule. Now it is an international one. All over the world, they mostly do it the same way. But anyways, this is one of the questions that you get. You do get questions about development in children, and you do get questions about vaccinations. To be honest with you, when you're in a GP setting, as a GP, we don't memorize these because we're not the ones that deal with vaccinations. You might get someone who asks you about it, but you don't necessarily have to remember it. You can just, look for it. But for the examination purposes, you need to know it. Now, for development, however, you'll need to know it by heart, even as a GP, because then you'll need to know when you should refer these children. If, for example, they don't walk at a certain age, if they don't talk at a certain age. So these are quite important in our practice. But for the vaccinations, my personal opinion is it's just for examination purposes. So we're going to move on to the last question. This is an admin question. Basically, this is 55-year-old male patient who's has terminal end-stage metastatic lung cancer. His prognosis is 2 to 3 months. He's asking about benefits. Which one of these forms, as a GP, you would fill for this patient for him to get his benefits? Yeah, so those of you who said C, yeah, that's the right answer. Is the SR1 form. Now, when you're a GP, you're going to deal with a lot of forms that you need to fill in or, tell the secretaries or admins to do it for you. Now, the SR1 form is the medical report that we fill in for the terminally ill patients that are expected to die within a year. And this is for them to get their benefits like quicker. So it's basically fast tracking their benefits and getting it a bit at a higher rate since they might not survive the year. Okay, on to the SCA exam. Now, this exam keeps on changing throughout the year. I don't know if you heard We had the CSA before, and then we had the RCA, and then we have the SCA. So they keep changing the format. Now they're saying that this is going to be the permanent exam for GPs from now on. But I would say never. You never know. But anyways, for now, the SCA exam is an online exam. You can take it ST3 plus. It is basically 12 stations. Each station is 12 minutes, and then you get 3 minutes in between the stations. It's the same thing. The maximum attempts were four if you were in the training before 2023, but now if you're in the training after 2023, again, it is 6 attempts. For this exam, you can actually book it 12 months in advance. So if you want to plan ahead and book the exam a year before, then you can do that. Now the exam has runs all through the year almost. So it's from September to June, except for December. So in every month you have about 3 days for the exam. So I would say there would be plenty of seats for this exam. Now it is a bit more expensive than the AKT. It's 1,207. And you book these exams through your 14 fish or through the RCGP portal, whatever way you want to do it. Again, plan ahead for these exams because you want to really prepare well for them and you just want to get it over with. But this is how basically the exam goes. Now, for preparing for this exam, I don't know if you have sat the PLAP 2, but it's similar to the PLAP 2 exam, but it's just online instead of face to face. Now, the most important thing I would say for the SCA is to practice. So practice a lot for it. Have a good study group. You don't want someone who's not on the same level as you, or who's way better than you as well. You just want someone at a good level, and you want to practice like a lot, basically on a daily basis if you can. Now, there are certain consultation modules that would be expected from you to use during your SCA exam, like the ICE approach. I don't know if anyone of you has heard about the ICE, but if you've not, then let me know. I'll just tell you about it real quick. Now, getting feedback and reflection, I would say do it with your supervisor. So a lot of us, when we were ST2s, we would video record our consultations, like the real consultations in our practice. And then we would just sit with our supervisors doing tutorial and go through them. It's really good and efficient to get a feedback. If you have any seniors around, like senior trainees, like if you're an ST2 and there's an ST3 around, then maybe that would be a good idea as well. Okay, I would say time management is key, again, for this exam, because it's very important to be on time. Now, the video recording that you do in the practice, you have to do it in a way that's consented. So you'll only do it through the 14 fish. So there's an app that you download for your 14 fish that you can record the consultations. You cannot record the consultations through your phone at all. So do not use your own personal mobile without this application in order to record the consultations. And then you'll just show your supervisor these consultations. Again, it will be through 14 fish. But if you're still in ST1, it is still early to go through that, but this is how we do it. And then we can send the patients to either ask the reception or we can send the patients ourselves before we start the consultation. Now, very common pitfalls for the SCA exam is missing your ICE. Poor structure. For example, you're taking a history and then you're taking like the history of, let's say, pain, and then you ask about social, and then you go back to the pain history. So being all over the place is not a good thing. Over investigating the patient is not a good idea. Being over empathetic, again, is not a good way to approach the consultation. Some people are very robotic, so they're just memorized a few lines that they say, and it really shows. Because don't forget that this is online and it will be recorded, and then the examiners will be seeing your consultations through the video. So you don't want to really be showing yourself as robotic in the exam. Now, forgetting the safety netting, or running out of time and not safety netting the patient, which again goes into poor time management. So you want to be able to go through the consultation fully, diagnose and manage, and safety net the patient all in 12 minutes. Okay, so we're gonna do a few cases together. Now, I just need a volunteer, if that's okay. If anyone can volunteer to do this case with me, I'll be the patient. We're not necessarily gonna do a whole full consultation, but I just want to see how your thoughts are. Abdul, yeah, if you want to go ahead.
Hey,
Hello.
I'm okay to do it, but please ignore my pitfalls.
That's okay. It's absolutely fine.
Is
Uh,
it timed? Is it going to be timed?
no, we don't have to do. I'll time it here. I'll time it outside, but we don't necessarily. If you or you do want a timer on the screen, it's up to you, really.
No, no, it doesn't matter. Thank you.
Yeah, okay.
Let me know when to start, please.
Sorry.
Let me know when can I start, please.
Yeah, you can start now.
Okay. Hello.
Hello.
How are you today, sir?
I'm okay, thank you.
My name is Dr. Reza.
Yeah,
I'm a GP ST3, and we're going to have a chat today together.
yeah.
Okay. Can you tell me why you're here today?
So, doctor, I was asked to come and see you because of my blood pressure.
Uh-huh.
Yeah, so I don't
And,
know
uh-huh.
really.
Go ahead, sorry.
Yeah, I don't know. I was just told to see you because of my blood pressure.
Okay. How long have you been having this high blood pressure?
So, I think it's been years now, maybe like 9 years now.
Okay. And how do you manage?
I take some medications, which is okay.
Mm-hmm. May
Yeah.
I ask what medications you take?
I don't remember the name exactly. It was something Prill.
Okay. I took a look at your notes before we started this conversation. It was lisinopril, 20
Yeah,
milligrams.
yeah, I think
Yeah.
that rings a bell. Yeah.
Okay. And how does it work for you? How do you get along with it?
It's good. Yeah.
It's good. Okay.
Yeah.
Any problems? Any issues?
No, I've been managing okay with it.
Okay, good. And how often do you take your blood pressure at home and all? Do you do it at home and all or not?
Honestly, I don't really check my blood pressure at home.
Okay.
Yeah.
And may I ask if you have any other conditions going on?
Yeah, so I have diabetes. I
Uh-huh.
also take medication for it.
Uh-huh. And I read on your notes you take metformin, is that correct? Twice a day?
Yes, yeah.
Okay. And any uh any other conditions that you have except for hypertension and diabetes?
No, that's it, really.
And any family history of any conditions running in your family?
No, not really.
Not really your first degree, like mother, father, brother, sister.
No, everyone seems to be okay.
Okay. And how is life going on in
Um,
general? How is your life?
Good, I would say. Pretty chill.
Yeah. And who's in the family? Who's at home?
I live with my wife and three
Mhm.
kids.
Okay. And any stressors, anything specific that might cause any anxiety or stress in you?
I mean, I work as a driver, so I wouldn't say it's the most calm job, but I'm a
Mm-hmm.
chill person, so not really.
Okay. And do you ever smoke or drink alcohol?
No, never, no.
Oh, okay. And what about exercise? Do you exercise regularly?
Not really, doctor.
Not really. And how is your weight? Is your weight stable?
I mean, it is stable. They keep
Uh-huh.
telling me I need to lose weight every time I come here.
Okay. And have you done anything in this regard?
Not really, no.
And do you intend to do anything?
It's a bit difficult with my job, to be honest with you, because I'm sitting all the time.
Yes.
Uh, so I would say no plans really.
Okay. And how do you think hypertension is affecting you, both on your health and on your social aspects?
I don't think it's affecting me at all.
Okay. And any concerns that you have? Are you worried about anything? Are you worried about that this high blood pressure might have any adverse effects on your health?
No, I mean, the nurse was more worried than me.
Uh-huh.
I think the number looks okay, but I don't know. I'm not
Okay.
a doctor.
Okay. So, uh, to be honest, your blood pressure is a little bit on the higher side.
Okay.
You are taking medication, which is good.
Mm-hmm.
There are some things that we can help to reduce this blood pressure.
Okay.
As I assume people have already told you before,
Yeah.
one of them is avoid smoking, which is a good thing you don't smoke.
Mm-hmm.
Avoid too much alcohol. A good thing, again, is that you don't drink alcohol.
Yeah.
And regular physical activity
Mm-hmm.
has a very good effect on lowering the blood pressure. I
Okay.
know it's hard with your job. I know that it might not be the easiest thing to do for you,
Mm.
but there are some minor solutions or minor changes you can uh, do in your lifestyle.
Okay.
Like, for example, is this just an example? I'm not sure if it's going to work for you.
Yeah.
One of them is like you can, whenever you come back from work,
Mm-hmm.
you can park your car a little bit away from home,
Yeah.
and you can start with about half a mile further.
Mm-hmm.
So in this way, when you go home, you can walk about half a mile, and then the next day when you want to go to work, you walk another half mile.
Yeah.
Okay?
Mm-hmm.
Makes sense?
Yeah, I think I'm
And then
considering.
little by little, you can increase this distance. For example, after a week or 2 weeks, whatever you're comfortable with, you
Mm-hmm.
can go instead of half a mile, you can put it 1 mile.
Okay.
And then go on with this and see if it makes any changes, if it makes or you have any issues with it,
Mm-hmm.
and then we can always have a chat uh, one more time to see how it's going on. Or if it's convenient for you, we can even give you a call back home. How
Okay.
does that sound to you?
I think I can try. It doesn't sound like a
Okay,
bad idea. Yeah.
okay. The other thing is, if it's possible, if you can uh, get we call it a sphygmomanometer. It's a device that you can take your blood pressure at home
Mm-hmm.
and then record it for us regularly. Even twice a week might be fine.
Okay.
And then record it on a piece of paper with dates and time.
Mm-hmm.
And then on your next visit or our next call, we can have a chat about it together. How does that sound to you?
Yeah, I guess I can. It sounds okay.
Yeah?
Yeah.
But yeah, some general advice about taking blood pressure. We want you to take it, first of all, at least 2 hours after you had had a meal.
Mm-hmm.
We want your bladder to be empty. And
Okay.
we want it to be at a time that you're not feeling stressed.
Yep.
We want it to be, we don't want it to be after you take coffee or tea.
Mm-hmm.
And then we can go and check once again together to see if it makes any difference in your blood pressure.
Okay.
How does it sound to you?
I mean, it sounds okay.
Okay. So at the time being, I'm not going to change your medications.
Mm-hmm.
Okay. Let's do the lifestyle change and see what happens.
Fair enough. Yeah.
Okay.
Yeah.
Is there anything else that you wanted to mention in this in this visit?
No, I mean, if you're happy, I'm okay.
Okay. So to summarize, uh, you came here just to have a chat about your blood pressure.
Mm-hmm.
We went over your medications. We went over your lifestyle. You're happy to change it, make small changes in your lifestyle and see how it goes.
Yeah.
Okay?
Yeah.
But there are some issues I wanted to mention. We
Mm-hmm.
call them red flags.
Okay.
Anytime, if you have any severe headache,
Yeah.
any chest pain,
Mm-hmm.
any palpitations, any shortness of breath, any eye problems,
Mm-hmm.
okay? Uh, in this case, I want you to seek medical attention or go to the A&E as soon as possible.
Okay.
Okay?
Yeah.
It might not happen at all, but I'm just giving you a heads up. Okay?
Okay, sure. Yeah. I think
Okay?
I'll remember that.
Wonderful. And if there's anything else I need to cover for you,
No, thank you so much.
okay? I really appreciate it that you came and attended your appointment today, and I wish you a wonderful life.
Yeah, thank you so much, doctor.
You're very welcome. Have a nice day. Bye.
Thank you.
Welcome.
Okay, well done. So, if anyone wants to give us some feedback, what do you think went well? And yeah, so in general, I think you did so well because this is like your first case. You asked a bit of history, you've asked about the social, and you've gone through the red flag safety netted. That's all basically. There's a few things. It's mainly for exam purposes that we normally do with these cases. First of all, when you're in the exam, or even like, in the normal GP setting, the patients, they get very pissed off if you ask them about questions that are already there in the record, like asking what kind of past medical history do I have, asking about the medications that I take. So for examination purposes, when it comes to, for the exam, whatever notes you have in front of you, do not ask the patient again about it. You can go through it. You can say, I can see here that you have hypertension, diabetes. Is that right? You can say that. But and I can see that you take, for example, lisinopril and metformin. Is that still the case? Are you taking them regularly, for example? First of all, it shows the examiner that you're concentrating, that you've read the notes very well.
Mm-hmm. I got
And,
it.
and
Yes.
second, you don't really get on the wrong side of the role player. Uh,
Correct.
because, if they have in their notes, be rude or whatever, if they ask you repetitive questions, then they're going to do that because they're just actors at the end of the day.
I got it.
Um, Julia here said the management wasn't a shared plan. I heard doctor talking more than the patient. Yes, you're gonna come to know how to do a shared plan management when you're in the GP setting. Um, we mostly use it more in GP. In the hospital, sometimes I've not seen it, if doctors do it very much. But in the GP setting, we like to do what we call like shared management. For example, what do you think? Instead of, saying your opinion at first, you're gonna have to say the diagnosis on your own. So you're gonna say, for example, your blood pressure is high. What do you think can be done about it? Because this is not someone who's newly diagnosed, this is someone who's been diagnosed for 8 years now. So he might have
Mm-hmm.
an idea or two about what he needs to do.
Mm-hmm.
He might have been told about losing weight and diet and exercise, exploring a bit more why he's not managed to do that. So I mentioned because I'm a driver and I drive all the time.
Mm-hmm.
I think your ideas about lifestyle were really good. So like parking the car a bit further, so on. The problem with the exam is the time. If you have enough time, you can touch base on the diet as well. What does he eat? And so
Yes. Yeah.
now,
Yeah. I forgot.
yeah. Now, in real life, it's a bit tricky because with this high blood pressure, it might be just because he's in the GP setting, and some people get a bit anxious when they're in the doctor or the nurse's office and their blood pressure shoots up a bit.
Yes.
We don't always 100% go with the blood pressure reading in clinic.
Mm-hmm.
Now, there's, however, certain targets and certain readings that if we go above it, then we might just increase the lisinopril a bit. But this is something that you explore with the patient. So do you want to maybe try lifestyle, or are you okay for us to increase the medication? Maybe I'm more comfortable about increasing the medication and I don't really want to do anything about my lifestyle.
I got it.
So shared management is really key in the GP setting and also in the exam. But I think overall, because this is, the first case, you've done quite well. If
Thank you
anyone,
so much.
you're welcome. If anyone has
I
any
appreciate it.
opinions, any questions, if you personally, Abdullah, have any questions about this case specifically,
No, I'm good. Thank you so much for your explanation. Yeah, appreciate it.
yeah. Um, so then again, you're gonna ask about all these. You're gonna go through the blood pressure, what it means. Asking him to take the readings at home in a more comfortable setting is a good idea. And it depends on what the patients want to do. Some of them would just want to do lifestyle because they're not as very keen on the medications. But some of them are just going to go like, yeah, sure, increase the medication. Now, my question is, if we increase the lisinopril, is there anything specific that we do after increasing the dose?
Checking on UNEs.
Yeah, so we need to monitor the UNEs. If we start the ACEs or if we are increasing the doses. So we normally do it 2 weeks after starting or increasing the dose, just to make sure that it's not affecting the kidneys.
Mm.
Is that okay?
Yeah.
Okay, so take your time, read the case, and let me know when you're ready.
So the information I'm seeing is the only information there.
Yeah,
And who is Sophie coming with?
her mom.
Okay, it's a face-to-face.
No, so it's a video consultation.
Okay. Hello.
Hello.
Hello, this is Dr. Hussain from the surgery. Can you confirm your name, please?
My name is Sarah.
Right. And this consultation is about Sophie, right?
Yeah, I'm Sophie's mom.
Okay, that's great. Can you confirm the date of birth for Sophie?
So she's 2 years old. She was born in October 2023.
Mm. Right. So what's been going on for Sophie?
So basically, doctor, she's had this itchy rash on her arms and legs.
Mm-hmm.
That's been going on for a while. And I just thought I would give you a call to see how can we help her.
How long is a while? How long has she had this?
So I would say a good few months.
Right. And did it all appear at the same time or it progressed to have to spread on both arms and legs?
No, so honestly, it started like in her arms first,
Mm.
and then now it's at the back of her legs, around her elbows, so it's all over really.
Yeah. And is she comfortable? Is she itching or complains of pain?
No, she's not very happy. She's quite itchy. Sometimes she wakes up in the middle of the night,
Right.
because she's itchy and she's crying.
Yeah.
So that's why I came here today.
Yeah, no, I appreciate. And what about fever? Have you noticed any fever, cough, or cold-like symptoms for her?
No, not really.
Right. Has she been eating and drinking well?
Yeah, she's been eating and drinking okay.
And have you noticed on urine, her passing of urine, is there enough wet nappies?
Yeah, it's absolutely fine.
Yeah. And when did she last open her bowel?
She opens them every day.
Was it loose the last time, last few times that she has passed?
No, I would say just normal.
Okay. So just to make sure that I've understood, rash appeared both on arms and legs over
Hmm.
the last a few weeks. She is she's itching and is uncomfortable with it.
Yeah, so it's few months. It's been going for a few months now.
Yeah. And there has been no fever or preceding cough or cold,
Mm.
and it hasn't affected her eating or other functions. Is that right?
Yeah, that's right.
Can I check a little bit about her birth? Tell me about how was it a vaginal birth? Was it a difficult pregnancy for you? Uh,
So it was a normal delivery.
mhm.
They used a bit of forceps, but it was fine.
Right, right. And so far, she has been meeting all her milestones.
Yeah, I would say I'm happy with her.
Yeah. Is she the only sibling at home, or that you have other children as well?
No, I have another kid.
Yeah. How old is he?
He's
What,
5.
5.
Hmm.
And do either of them attend nursery?
Yeah, they both go.
Okay, okay. And are you a working mom?
Yes, I am.
Right. What do you think is happening? Any idea?
I'm not really sure. Like at the beginning, I thought it was allergies,
Yeah.
but I can't really pinpoint what is she allergic to.
Mm. What made you think that it could be an allergy? Have you changed any of her toiletries or clothings or nappies in the last few months?
No, but because it's itchy, I just thought
Mm.
allergic rash. I don't know.
Yeah. She hasn't had any breathing difficulties since you noticed the rash.
No.
Is she fully vaccinated?
Yes, she is. Yeah.
Okay, that's good. That's good. Right. And anything else you want to add? Is the other sibling well, or he's also showing?
He's absolutely fine. He's okay.
Yeah. What's your most important concern? What's concerning you most?
The itchiness really, because now it's bothering her life. Like even her teachers in nursery have noticed
Yeah,
that she's itching. She's a bit irritable when she's
yeah,
itchy.
yeah. And the rash, does it come, disappear, and then come out in another crop?
No, so it's constantly there.
Constantly.
Sometimes it looks angrier,
Mm,
um,
mm.
but that's it really.
Do you think any infection might be going on?
I wouldn't be able to tell, to be honest with you.
So any discharge from there, any
No,
scales or anything, have you noticed there?
no.
Okay, okay. Right, I can understand you are worried about her. From what you have described, well, we can't rule the possibility of an allergy causing that rash. Some of the allergies may show up not immediately, but later, and it will require understanding carefully that what is underlying this.
Hmm.
Uh, I'm thinking of various possibilities that could be there.
Yeah.
Sometimes even, have you heard of cow's milk allergy?
Yeah, I have.
So sometimes the rash for that appears quickly, but there's a different mechanism to it where it can take longer to appear once, even after the child has been weaned and has been put on solids. So that's one possibility, but without seeing, it's difficult for me to understand what exactly it could be because a number of conditions can cause it. And
Hmm.
I would like to ideally see her face to face, examine the rash, and then identify what will be the best investigation suitable to find an answer. Of course, we can give you some cream and some medications to help soothe the rash and
Mm.
the itchiness she is having. At this stage, I'm not able to rule out that it is not an infective cause that is giving rise to this rash, but usually they come with fever and other signs like discharge. So that is not there. So allergy is the most likely possibility. And are you able to come and bring Sophie to the surgery for a face-to-face appointment?
Yeah, I can take her out of nursery and come. But what is it today that I'm gonna see you?
I would prefer to do it as soon as possible. I'll ask the reception to have a look at the system and identify a slot. If this today is a good day for you also, unless there's some reason, then if you suggest a time and I could try to fit her in that time.
Okay. And you've mentioned something about cream. What kind of cream are you gonna give us?
So again, if it is an allergic rash that is causing a problem,
Hmm.
we could give some mild steroid creams initially.
Hmm.
And depending on how it looks, it can be given along with some uh, antibacterial or antifungal component to it, mainly to, if it looks infectious, it might help keep that in control as well. Um, it is very important at this stage. I know we haven't made a diagnosis yet, a certain diagnosis yet, and we are discussing possibilities.
Yeah.
But all these cases, it's important till infection has been completely ruled out to maintain to make sure that through hygienic measures, there's not an ongoing cycle of infection between the family members.
Hmm.
So it's very important to keep different clothes, have a bit of isolation between the older sibling and Sophie. And I mean, let's look at the various appointments and in the afternoon, if it's possible for you.
Hmm.
Really want to see Sophie first today.
Okay, but doctor, I've heard that steroid creams are not good for young children. Is it not gonna damage her skin?
I'm talking of very mild steroid creams, which are unlikely to damage the skin and give her reasonably soothe the inflammation to make her comfortable. There are a number of steroid creams and they are graded in a stepwise manner. So what I have in mind for Sophie is something which is lower down on the ladder.
Mhm.
And we can go through it in detail when we meet later with Sophie. And so it will basically, it shouldn't damage the skin, but it will take away the inflammation, which is giving rise to all these acute symptoms of itchiness, having to scratch, and then causing so much discomfort to Sophie.
Okay. Okay, that's fine, doctor. I'll try to bring her through.
Is there anything else you would like to ask?
No, that should be okay.
Great. Okay. Thank you.
Thank you so much.
See you later. Bye.
Okay, what do you think about this case?
I don't know. I was completely at a loss what it is.
Anyone wants to say anything about this case or give us any feedback? With children, it's a bit tricky because even in real life, we always like to bring children in for face to face, especially with rashes. Yeah, asking about things that would make it worse, things that make it better.
Mm.
That's Abdul suggesting that. Yeah,
Yeah,
that's
yeah,
one.
that's fair point.
Uh, in children, it's very important to ask about family history. Now, if you would have asked me, I would have said that I have asthma and her dad has eczema.
Okay.
So this is a case of eczema in a child.
Yeah.
Now, again, with the exam and in real life, if you come across like a telephone consultation, it's difficult to diagnose rashes just by talking to the patient.
Mm.
Most of the time in the exam, if they're gonna talk about like dermatological stuff, they're gonna have a picture in.
Mm.
But if they don't, it's always okay for you to say some differentials. So here we're querying, is it eczema?
Yeah.
Is it urticaria? But with
Mm.
urticaria, it wouldn't really be going ongoing for months.
Yeah.
It would have more of an on and off kind of presentation.
Mm.
Is it a fungal infection? In the exam, you cannot ask for a picture, but if whatever you have in the notes is what you get. But in real life, yes. So if this is a telephone consultation in real life,
Mm.
you can actually send the patient a link for them
Mm.
to send you a picture. So if you can't really see them for whatever reason,
Mm.
or if the parents can't bring them in, it's absolutely fine for you to ask for a picture. Um, and just, seeing if you can assess it through that.
Yeah.
But overall, I would say you've done well. Honestly, there isn't like a specific thing that you can say this is 100% this or this is 100% that.
Mm.
Sometimes when you ask about the family history, it might give you an idea. So if I have asthma, her dad has eczema, then it's most likely that this is an atopy that's going on.
Mm. Mm.
So yeah, giving steroid cream, emollients, but seeing the patient is the main thing here. You want to see the patient. Now, for exam purposes, with these cases, it's always good for you to have like a shared consultation. So try not to talk more than the patient. Try to give them a bit of time to like acknowledge what you're saying and take the information in. So for example, let's say we were going to say a diagnosis like this is most likely eczema, and then you seconds of silence, and then you can say, do you know what eczema is, for example?
Mm.
So it would be more of a shared consultation because if you're talking more than the patient in the exam,
Yeah.
it's not going to look so good.
Okay.
But overall, well done. I don't know if you all know the management of eczema. It's a bit tricky. It's not easy to honestly to manage eczema, especially in children, because a lot of them are resistant to treatment. A lot of them would have like severe eczema. But the main way that we treat eczema is steroids and emollients, like plenty of emollients. A very common question that parents ask that steroids are going to cause damage to the skin, they're going to thin the skin, and they don't like to use steroids a lot. Now, this is a true information. However, eczema can cause damage to the skin as well if it's left untreated, or it can cause like infection. So it's really thinking about the benefits versus the risk in these situations. So whenever someone is reluctant to take certain medications for whatever reason, you need to try and reason with them and try to explore like the benefits versus the risk. And then it's up to them if they have capacity and they can actually refuse treatment, that's fine. Is that okay? Does anyone have any questions about this specific case or in general about the exams?
It was good, thank you.
Yeah, thank you so much, Sabina, for helping with this case. Um, Now, an important question to ask is how much time do you need to prepare for these exams? I would say there isn't a set time. Everyone is different, isn't it? So it depends on how you know yourself. You're gonna ask yourself how much time did you need to prepare for other exams? So if anyone again has sat the PLAB 1, PLAB 2, they would roughly know how much they would need for the AKT and SCA. I would personally advise at least 2, 3 months. You don't
Mm.
want to be preparing for these exams in 1 month and then paying all this money and sit in it and just risking failing the exam.
Mm.
First of all, you don't want to have so many attempts because you only have limited amount of like attempts. And second, you don't really want to be paying all this money 2, 3 times.
Mm.
Uh, I don't know about you guys, but I wouldn't want to do that.
Yeah.
So planning ahead is a good idea. So at least 2, 3 months in advance with each exam. That's my personal advice, but it depends on how much time you take. Maybe you can take information in faster, but we're doing these exams while working, so it can be a bit tricky to find time to study for them. Okay, any questions at all about the MRCGP exams or anything we've discussed today?